Third quarter training. Topic: Stages of Alzheimer's. What is Alzheimer's? According to the National Institute on Aging, 2024, Alzheimer's disease disrupts communication between neurons in the brain, causing widespread loss of cognitive or brain function, resulting in the neurons misfiring and permanent brain damage. Alzheimer's is a progressive disease that causes symptoms to worsen over time, and it's the most common cause of dementia, which is an overall term for memory loss, cognitive impairment, and a collection of symptoms that affects an aging person's ability to perform ADLs and function independently. There is no cure, but there are treatments available that aim to slow the progression of the disease. Alzheimer's is not a normal part of aging. Keep in mind that cognitive changes do naturally occur with age. However, the hallmarks of Alzheimer's are often severe memory loss, confusion, and behavioral changes. Who's at risk? According to the American Hospital Association, 2025, an estimated 7.2 million Americans are living with Alzheimer's disease, and nearly two-thirds of those diagnosed with the disease are women. Women have a higher risk of developing the disease than men because women tend to live longer. The greatest risk factor is aging, and those at the highest risk are age 65 and older. An aging person may be asymptomatic for many years due to biological changes related to Alzheimer's occurring in the brain while not being detected because no cognitive or behavioral changes occur. When symptoms appear before age 65, it's referred to as early onset Alzheimer's. Early signs of Alzheimer's. This time period is referred to as preclinical Alzheimer's, which refers to cognitive changes being present but not severe enough to meet the criteria for a dementia diagnosis. According to the Alzheimer's Association, these are the 10 early signs of Alzheimer's. 1. Memory loss that disrupts daily life. Example: forgetting important dates or information. 2. Challenges in planning or solving problems. Example: having trouble following a recipe or taking longer than usual to answer a simple question. 3. Difficulty completing familiar tasks. Example: having trouble navigating to a familiar location. 4. Confusion with time or place. Example: forgetting where they are or confused about how much time has passed. 5. Trouble understanding visual images and spatial relationships. Example: having trouble judging distances and making it difficult to operate a vehicle. 6. New problems with words in speaking or writing. Example: repeating themselves often without realizing it and struggling with the name of a familiar object. 7. Misplacing things and losing the ability to retrace steps. Example: losing things often and not being able to retrace steps. 8. Decreased or poor judgment. Example: paying less attention to personal hygiene. 9. Withdrawal from work or social activities. Example: withdrawing from hobbies and avoiding social interactions. 10. Changes in mood and personality. Example: becoming confused, suspicious, depressed, fearful, or anxious at home and outside of comfort zones. Why is early detection important? Early detection in yourself and others is important to better improve treatment outcomes. If you find yourself or someone you know displaying early signs of Alzheimer's, the first step is to share these concerns with a doctor and determine if you need to meet with a neurologist, a doctor that specializes in diseases of the brain and nervous system, or a geriatrician, a doctor that specializes in the care of older adults and dementia. This concludes the end of the early stage Alzheimer's training. Continue to middle stage Alzheimer's.